Hello. So in this video we are going to talk about the pros and cons of different types of breast reconstruction, which will help you in choosing an implant reconstruction or a tissue flap based reconstruction, which is autologous breast reconstruction. So there are a few points which will be comparing both types of reconstruction. First is the quality of reconstruction. So an implant will never mimic a normal breast. However, if you are choosing an implant based reconstruction, then a silicone implant would be much better than a saline based reconstruction. And autologous tissue reconstructions, because they come from the patient's own tissues, they will mimic the normal breast more naturally, and they will age with the opposite side breast more naturally. The second point which has to be considered is loss of sensations. For implant based reconstructions, there would be some loss of sensation in the operated breast. However, if you are doing a tissue flap based reconstruction, there would be a loss of sensation in the operated breast and from the site where the tissue has been taken. The third is the duration of surgery. So generally speaking, an implant reconstruction would go for around 2 to 3 hours, the reconstructive process. If you are undergoing tissue flap based reconstructions, depending on the various flaps which are available and what kind of thing you are doing, whether microsurgery is been undertaken or not, the surgery would take somewhere from 4 hours to 10 hours for a breast reconstruction. The third point which has to be considered is hospital stay. So the hospital stay is lesser for an implant based reconstruction. For a tissue flap surgery, the hospital stay would be around 4 to 5 days. The fifth point is the durability of the reconstruction. So once the reconstruction is done, whether you will have to repeat the procedure somewhere in future. Implants will generally have a lifespan of 15 to 20 years. So you might have to maybe replace your implant if you are undergoing an implant based reconstruction. However, once the tissue flap reconstruction has been done, you will not have to replace it ever again. And the one more thing which we need to consider is risk of complications. So generally speaking, implant based reconstruction, the complications would be slightly higher than that of tissue flap based reconstructions. However, the overall incidence of complications for both these surgeries is very low. The third thing which we have to consider, the last thing basically which we have to consider, is risk of failure. So if you consider complete failure or partial failure, so if you are considering complete failure, the risk is slightly higher with implant based reconstructions. However, partial failure rates are much more common with tissue flap reconstructions. So these are the various points you should consider. One is quality of reconstruction, the loss of sensation, the duration of surgery, hospital stay, durability, risk of complications and risk of failures, which you have to consider while choosing a breast reconstruction surgery.